What's next for medical marijuana research in Pennsylvania now that Governor Tom Wolf has signed the state's bill into law? It's a question the Pennsylvania Medical Society asked during an April 20th media call-in with researchers. These researchers are investigating marijuana and its components that could potentially be used in treating a variety of diseases.
There really is very little evidence from a research standpoint for the efficacy or effectiveness of cannabis or cannabinoids for a number of medical and psychological conditions for which it's been legalized at state levels. And so really the cart's far before the horse, and we're trying to catch up from the research angle.
The fact that cannabidiol is a Schedule I drug makes it challenging anywhere, and that reflects why there's so little in the medical literature regarding, at least the American medical literature, regarding cannabidiol and other forms of medical cannabis, because it is a Schedule I drug. In theory, if these two studies prove positive, and the Dravet study, the GW Pharma just recently released the results of the Dravet study, which was very positive and had significant results. Theoretically, what would happen is these drugs, with the cannabidiol, would have to be rescheduled because now it is a drug with clear medical use.
The new law provides state funding for healthcare institutions in Pennsylvania to study the use of medical marijuana to treat other serious conditions.
Part of the provision of Senate Bill 3 is, in fact, that the monies that are some of the monies that are generated from the sale of medical marijuana in the Commonwealth will, in fact, go toward research on medical marijuana within research institutions in the Commonwealth. So any of the kind of research institutions in the Commonwealth will be able to apply for those funds to conduct research to help us better understand what are the best practices in prescribing.
Learn more and listen to the entire media call-in by visiting pamedsoc.org/medmarijuana.